It was a partner of ours that reached out to Dr. Vasquez.
So Jericho reached out to us, to Dr. V, and basically told him the opportunity that they had about having extra vaccines.
Typically, it's the other way around. Typically, it's Dr. Vasquez that gets everything first. It's Urban Family Practice, it's G Health Enterprises, and we tend to share with the rest of the community. So it was really a breath of fresh air to see one of our network providers reaching out to us directly and saying, hey, look, here's the situation. We have an overabundance of vaccines. We would love to vaccinate you, your staff, and everybody that works for you as far as employees go so that everybody's protected.
I was a little overwhelmed because I got the message on my phone and I was at a doctor's appointment. I saw it and had to read it a couple of times. We're going to get the vaccine. This is awesome.
Yesterday we were able to vaccinate with the Moderna, thanks to Jericho, Dr. Blake, 50 staff members. Today we'll be finishing 100 staff members in addition to that. So 150 people out of our 220 so far were able to get vaccine. So 75% of our staff will be vaccinated. It's so important to do this in light of the work that we do. We're healthcare, we're essential workers and healthcare providers. So this is an example of what we had to do in order to make sure that we got the vaccines into staff arms. And I think it's going to be real important to develop all these ambassadors in order to get the community focused to really take this vaccine.
And so walking into Jericho was priceless.
Like a temperature procedure, walked into the room.
We had to fill out our forms.
They wanted to know certain things about you, so we did that.
Pretty much like our history.
Nothing too personal.
Which did not take long.
And it was nice to see Dr. Vasquez there front and center. He was not only helping individuals complete the forms, but he was directing all of us into the different rooms.
They collected all of our paperwork.
They put us into the system. Terrence was really great with that. And so was Debbie.
And then we waited in a waiting area.
It was a good environment. Like, it was very clean.
Some other phases were there.
A wealth of resources for asking questions.
I know that some folks had a concern or two. And
originally, when they said that we would be getting a vaccine, not G Health, but just in general, I wasn't sure. I was kind of still on the fence about it. And I was like, I'm not getting it originally. I was not going to get it.
Because of the Black and Brown community, of course, we have concern because of our past history with certain vaccinations and things that went on in our African American history.
We were going to wait out 9 months to see what the outcomes were going to be.
I'm not scared of needles. I was scared of the shot.
The vaccine.
Period. Like,
yes, I did get nervous. Very, very nervous.
Well, I mean, of course, I was a little nervous, just, wondering.
I was a bit nervous, so it was really nice to see my boss waiting for me and making sure that I felt a little bit more comfortable.
I've had my doubts. I thought I was going to, might grow, horns out of my head or something like that. Social media plays into it, hearsay. There were so many things flying around.
Theories of this could, sterile them, where they can't have children and things like that.
And I read a lot of things, mixed reviews. And you're going to get a bunch of mixed reviews everywhere. But the fact that I got good, credible information from Dr. V and the providers I trusted, that was all I needed to reassure myself.
Dr. V's education changed my mind.
After the town hall meeting that we had, and a lot of things were more clearly explained as to what it actually was.
Very factual, easy to understand. There was no cutting corners as far as the truth.
It kind of gave you like a good mindset of like, okay, I trust in the doctors.
Dr. V has been my primary care doctor for 7 years. He's been my family's primary care doctor for years and years and years before that, and I just don't feel that he would put us in any harm's way by having us do this. And I always say he's always 10 steps ahead of everybody.
My daughter is also in the in healthcare, and she was like, "Mom, I believe you're going to be just fine. It's it's not like times of old where the Black and brown community is not being taken into consideration. They have Black and brown people at the table now.
All my worries I had, had a checklist, and I made sure that I researched and I contacted my care team. I started looking at doing some of my own research on it.
I want to make sure I ask the questions I need to ask.
The research is out there that you can look into it to make your decision.
I said I need to get it done.
And they started bringing people in.
I don't like needles.
All right, so honestly speaking, I am a little bit scared of needles. I don't know what it is. I think it was almost like that feeling when you're in a roller coaster and it's going up that big hill, ready to go down that very steep slope. I think that fear mixed with anxiety, I think that is what I would kind of equate it to. Even though I knew what to expect, there was just no way of getting rid of the anxiety and the fear. And I think that's what I kind of felt, that initial feeling on a roller coaster.
I was kind of tense, because we're waiting on whatever. We didn't know,
I actually got my shot directly from Dr. Fox. He was one of the people giving shots, which was, really awesome to see, because a lot of times it's just nurses or support staff getting shots, and it just goes to show how much they really do believe in it if they're the ones willing to be there and administer it. So that was kind of comforting to see everyone who was there and on board with it, all the providers.
The providers actually made me feel really comfortable too. I went in there petrified. I hate getting shots or vaccines and needles to begin with.
And I actually received the shot from Allison, which was kind of cool because I helped hire Allison.
I had my shot done by my personal provider at Urban Family Practice, and that made me feel even more comfortable. I was able to ask her any other additional questions, even though Dr. V did a great job clarifying all my questions I did have.
They had everything just in case if there was anything to happen to me. They had Benadryl, they had an EpiPen, and that just made me feel a lot more prepared and a lot more calm.
Thankfully I got Dr. Fox to administer it, because it couldn't have been smoother, in all honesty.
He was really reassuring the whole time. He made sure to make sure I didn't have any questions.
I had loosen up my shirt and expose my arm and all that other stuff.
I had Dr. Fox give me the vaccine, and he was really sweet, and he told me that it was not going to hurt him, just me.
It was real quick. It was really easy.
I didn't feel a thing.
You would almost question whether it happened or not.
I was waiting for the pain, and I didn't feel anything.
The needle was really thin, so when I saw that, I knew that was going to go in practically painless, and it did.
You really couldn't even feel it when he did it.
I actually asked the doctor, "Are you sure you administered the injection?" We laughed about it.
I knew it happened because I felt something, but at the same time, it was so quick.
It was super easy. It was all about 15, 20 seconds.
It was that quick.
After, we just had to wait 15 minutes to make sure we didn't have any reactions.
Dr. V was there making sure each and every one of us were okay.
Dr. V was walking by. Did you put your timer on? Did you put your timer on? Did you put your timer on? You're going to be here for 15 minutes. Are you okay? How are you feeling? Are you okay?
He wanted to make sure that everybody was fine afterwards, and we sat and watched the clock for 15 minutes.
Chit-chatting and everything like that. I felt fine.
He gave us some of the spiel on what we should be expecting, and then we'll be back in 28 days for our second shot.
Reminding us of the precautions, the safety precautions, and what we might experience.
And then they give you your little vaccination card, so you can take it home and keep it in your records.
I had them give it to me in my arm that I don't sleep on, so
I even slept on my left side. It's a little sore, but nothing that's like, oh, my arm is going to break. You know what I'm saying? I could lift my arm and everything, I feel a little tenderness, but...
I did wake up this morning with a headache, but I did actually have COVID back in November, and I experienced worse symptoms that lasted even longer. So I'm just thankful for only having a headache right now.
I felt a little bit of a dull headache, so I took some Tylenol, and I was fine.
I felt completely fine. Went home and finished working, and today I just have a bit of soreness in my arm. So it was really simple, really easy.
Last night I started getting a little soreness in the and the sight of the injection. And today, which is the next day, I still feel that.
I'm slowly lifting my arm. Like I lift it, it feels uncomfortable more than pain. It's just discomfort.
Ava taught me a nice trick that if I take my arm and bend it back like this, it starts loosening up the muscles in that arms. And frankly, the more I do this, the better it actually feels.
Just like you're doing an exercise.
So it's a nice exercise.
I think that helped with the soreness.
Not that I plan on doing that all day, right?
Years ago I had got a flu shot and I had an instant reaction, like really sick. And that's when my care team advised me, not to get any vaccines or injections that were live. I believe because it's a synthetic vaccine that my care team agreed for me to get it, because normally, like with the flu shot, the shingles, things like that, I'm not allowed to get it because of the underlying conditions. But they were very adamant about me getting it.
I'm good. I feel great now. Aside from the little soreness, but it's not really soreness, more like a discomfort. But aside from that, everything's good. Yeah, I can't complain.
I feel just a little bit of not pain, stiffness, maybe stiffness, and I would get that with any shot. So
that's it. It's just tenderness in my arm now, but I have no other complaints otherwise.
So the experience I thought was great. I thought it was professional. I was very much appreciative of the opportunity to take the shot because, frankly, Jericho Road opened up their doors for us. Dr. Vasquez has always been in continuous conversation with Dr. Myron Glick over there. Both these guys go back a long way. And when the opportunity came along, the doors were open and I went in and got my shot, and I'm thankful for that.
I feel like we were given an opportunity.
It felt like a very, like a weight was lifted off my shoulders. It was almost exhilarating that I got the shot.
I'm kind of glad I did.
Yeah, I'm pretty much a healthy person, but I don't want, we could be asymptomatic, and I don't, want to give anything to anyone else because I'm in good health and the person next to me may not be.
We were presented with the opportunity, and Dr. Vasquez, in my opinion, did the right thing as far as securing it and making it available to us. I'm very appreciative and grateful of that.
Kudos to Jericho and to Dr. Glick and to Dr. Kulikowski and their entire staff for welcoming us into their organization too as well. So it's pretty neat.
As we move along, I know that this thing is going to mutate or evolve into something else, and you always want to get whatever protections you possibly can. Some folks may object for one reason or the other. I got to tell you, some folks have got chronic conditions already, and they're worried about that. Some folks have a history of reactions and things like that. But you know what? If you've got chronic conditions, I'd rather face the chronic conditions with as much protection as I could possibly get my hands on, which would just help me overall in a general sense.
Getting the vaccine outweighs the risk of getting COVID.
Get the shot. It doesn't hurt to protect yourselves and protect everybody around you.
If it makes you feel better, do your own research, talk to your provider, talk to people that's knowledgeable.
Do your own research. Check it out for yourself. You know what I mean? We're always going to have doubt in our minds about something.
It's just, we're better to have it than not to have it.
And right now, you're an example for your family.
Encouraging them when, it does become available for them to take it.
It was nice to send a couple of pictures to my family, to my parents, to my sister, to show them exactly what it was all about. So that this way it kind of takes the anxiety and apprehensiveness away from them about wanting to get the vaccine when it's available for them to get it.
I actually also took a ton of pictures. Chelsea was there. I was setting up a little photo shoot with the vaccines because I'm very excited about it. I sent a picture to my parents, like, hey, look, I'm doing it. As soon as it's available for everyone else, I would definitely recommend getting it.
Yes, you might get a little arm pain. Yes, you might get a little bit of chills. You might get a little bit of fever, but you're not getting the worst of COVID.
From having COVID back in November, I'm really grateful for the vaccine, just because I would never wish COVID upon my worst enemy. It was probably the worst week and a half of my life. I was just experiencing so much vertigo and the headaches and the fever and the chills, and now that the vaccine's available, I'm just thankful that no one else is going to have to deal with as severe symptoms as I had.
I strongly recommend that everybody get the shot. I hope to never have to see another pandemic in my lifetime or in my children's lifetime. I can't guarantee that. And the next one may be around the corner, or maybe something else entirely different. So, I recommend that everybody get the shot.